So with holiday season here, a lot of us will be traveling a long distance to visit family and friends, and extensive travel can actually lead to a specific blood clot that can be very, very dangerous. Dr. Kevin Campbell here this morning with more. Doc, good to see you.
Good to see you, Phil.
Talking about travel, you traveled a long way just to get here this morning.
I did. I was doing some work up in New York City, and I was one of the folks stuck in LaGuardia for a while.
Okay, so we're talking about the DVT this morning, right? What is that?
So that's a deep vein thrombosis. In your leg, in your lower leg, there are two sets of veins that drain blood from the extremities. There's a superficial one that you see with varicose veins, and then there's a deep set of veins. These can form blood clots, and when they do, those blood clots can break off, and they can go into the lungs and cause what's called a pulmonary embolus, and this can be life-threatening.
And this comes from a lot of sitting, I understand?
It does. Whenever you're immobile for a period of time, up to 4 hours or so, you can develop these blood clots because blood flow is diminished.
Right.
So you need to do things to improve blood flow. Other risk factors include being pregnant, having a broken bone, having surgery, being bedridden for a period of time. Interestingly, if you sit for more than 4 hours on a car trip, the risk of DVT can persist for weeks.
How do you know you have it? What are some of the symptoms?
Good question. Redness, swelling, soreness in that lower extremity or the leg, down in the calf muscle is the most common place. If you see that, you need to see a doctor right away.
What are the medical complications associated with this?
The biggest thing is that thing we talked about, pulmonary embolus.
Yeah.
When you have this blood clot go to the lungs, it can block circulation to the lungs, and the lung tissue can die, and that can actually be life-threatening.
Anything we can do to prevent this?
There's some really good exercises you can do. Not everybody can get an aisle seat on the plane, but if you get an aisle seat, get up and be one of those people who paces in the plane about every 20 to 30 minutes. If not, just simply point your toes to the sky and flex your calf. And what that does when you move your feet up and down like that is it promotes blood flow in the calf and moves that blood around. Because all it is when blood stays still in one place, you can form the clots.
About 30 seconds left. Any lifestyle changes that we can do to prevent it as well?
Certainly you want to be active. You want to exercise like we talk about all the time.
Sure.
Also, you want to do things like make sure that you eat well, you stay hydrated, avoid alcohol and caffeine on these long trips. If you're in a car trip, stop every 2 hours and walk around. It's worth it. It's good for the kids anyway.
Absolutely. Good tips. Doc,
good to see you.
Always good to see you. Get some rest. And of course, if you have a medical question for Dr. Kevin Campbell, onto our website, WNCN.com. Search links we mentioned. From there, you can find Dr. Campbell's website, or you can like his Facebook page and Twitter.